mechanism of production of non-caseating granuloma. So what happens is this. So let's say this is the antigen, the ninja antigen, that we do not know what is the origin of it. Maybe one of these or maybe something else. However, when this antigen comes into the body, of course you know macrophages and neutrophils will pick it up and they will present parts of this on their surface, right? Normal innate arm of the immune system. Macrophages will now run with this antigen and go to the lymph nodes. So with the sarcoidosis, keep in mind the lymph nodes that are hilar and paratracheal lymph nodes. So macrophage is going to go and run there and say to the cells, which cells there? T cells and B cells sitting in those lymph nodes, and say, dude, I got this antigen. So the CD4 cell that is sitting here, so let's say this is a CD4 cell. CD4 cell will be presented with the antigen, and what would happen is it would start releasing IL-2. CD4 cell, when it would release IL-2, this IL-2 is going to cause proliferation of the CD4 cells. So we'll have monoclonal proliferation of CD4 cells. At the same time, CD4 cell is also going to release interferon gamma. Interferon gamma. That will activate the macrophages. Now this is the line that would cause granuloma formation. So this is the mechanism: antigen, presentation to the cells, CD4, proliferation of the CD4 cell, amplification of inflammation, activation of the macrophages, formation of large and active macrophages, which when there is continuous activation, then these macrophages will become fused and become, so now I'm going to fuse them, so they'll become multinucleated giant cells. Multinucleated, many nuclei, because this is a fusion of many cells. Multinucleated giant cells. Now how does this happen? When a macrophage becomes active, that macrophage in turn is going to release IL-8, tumor necrosis factor 2, and then macrophage inflammatory protein 1 alpha. All of these proteins not only cause inflammation, but they would also cause recruitment of more macrophages, monocytes and lymphocytes. So monocytes will also come in. So further recruitment and inflammation would occur. This would cause amplification of all of these cytokines. These cytokines would also act on the macrophages, and now the macrophage will convert into two types of cells. One is the multinucleated giant cell and the other is epithelioid cells. So what are epithelioid cells? Epithelioid cells. Cells, oid mean look like. So cells that look like epithelial cells. What does that mean? These are actually macrophages that have become hyperactive. They are usually long elongated cells. They are pink in the cytoplasm is pink, and they look like epithelial cells. However, they are irregular in their shape. So in these granulomas, what you will find is, you'll find lots of epithelioid cells. You'll find lots of giant cells, right? And then the granuloma itself, now this has become granuloma. It takes time to become granuloma. The granuloma is bordered or rimmed by, there is a rim of CD4 cells or lymphocytes around the granuloma. So this is the structure of this granuloma. Inside the granuloma, there are two types of bodies or depositions that are important to understand from STEP's point of view and from general histopathological point of view. One is that so if I make one big cell over here, let's say this is the macrophage, or a giant cell that is coming from here, I just brought it here. This cell has gotten, so let's say this is the nucleus, this cell could have concentric depositions inside the cytoplasm, deposition of calcium and proteins. So this is the Schaumann, Schaumann, Schaumann bodies are found, and it is also possible that there are deposition of the substances that look like a star, so asteroid bodies. IES, asteroid bodies. So Schaumann bodies are found, asteroid bodies are found. At the same time, imagine with this pathogenesis, with this mechanism, what will happen to the CD4 cells? So the CD4 cells are consumed, and due to that there will be energy, A-N-E-R-G-Y, energy to PPD and candida-like skin tests. So what does that mean? You do the allergic test, and ideally if the patient is allergic to something like PPD or candida, there should be a wheal and flare and a small induration that should form. However, because the immune cells are all consumed up taking care of this mechanism, there are not enough immune cells to go and do that induration formation or the local inflammation reaction, so the patient does not react to these antigens. So that is a very important thing to keep